What up, everybody? Dr. Ray here, Vet Triage. Um, we are going to talk about porcupine quills. It's August 30th, Friday, 5:09 p.m. Pacific time. A little bit late, but it's okay. Thanks for those who watch in the playback, who spread the word, who share, and all that stuff. So porcupine quills are not a condition that I ever dealt with in practice as a surgeon. However, it's very, very common, especially if you're in more rural areas and you have a dog that either is very curious about wildlife or goes hunting a lot or whatever, and or hiking with you, and then they get in trouble. They mess with the porcupine and they get quilled. So, what do you do when there's a quilling? And we'll just talk about some details regarding it. First off, again, I'm going to plug Vet Triage. It's a great option for these because most folks are really far away from a hospital, and their family veterinarian is not open when the quilling occurs, because it usually occurs like at night or whatever, because you're with the owner and you're not at work, or a weekend or a holiday. So your family vet's not open. So a lot of times you need home care, and believe it or not, we Vet Triage have some creative ways to take care of these pets at home. Occasionally, we've actually had to train pet owners on how to remove the quills, which is a process called dequilling. But in general, talk to Vet Triage will help you out. In the meantime, what you can probably expect once you do get to the vet hospital for a dequilling is they're going to sedate your dog and they're going to remove the quills. Do not cut the quills at all or short at home. You're not going to help the situation. Now, the reason why people are enticed to do that is because their dog is pawing at the quills and rubbing their face in the ground. They think, oh, if I make it shorter, it'll be less irritating. Yeah, but then it's going to make it much more difficult for the veterinarian to remove them. So let's keep those quills the way they are. Let the vet mess with them. They're going to sedate your pet. Now, sedation typically is going to be whatever the veterinarian needs. Most of the time, it's going to be short sedation, meaning they don't require general anesthesia, so there's no intubation, no tubing. It's going to be probably an IV injection, maybe in the muscle if you have a dog that's being a bit difficult, but otherwise it'll be IV injection for the quickest response. And it'll last 20, 30 minutes, an hour, a couple hours, depends on your dog, their age, any other health concerns, what drugs your vet uses, how long they're out for. Did your doctor have to re-administer more sedation because the process was taking a long time? I mean, some of these dogs just have a face full of quills on their face, in the mouth, in the nose. And so it could take your vet a while. It's not a simple case. And then once they're done with the quilling, they'll do a once over, make sure your dog doesn't have any other quills that they missed. And then from there, they're going to wake your pet up and then send them home. And whether or not your vet needs to do any preliminary diagnostics before the sedation is up to you, up to the vet, and depending on what your pet's risk level is. So, for example, if we're sedating a young dog with no prior medical conditions, it's probably safe to not perform any blood work before sedation, especially if you had recent blood work done, and there's no other symptoms before the quilling occurred, like vomiting and diarrhea or whatever. But if you have an older pet, middle age to older, then it kind of depends. And if you want to be on the safe side, you should do blood work, even though your pet was acting fine before the quilling and has no prior medical history. You're going to want to probably make sure that we're okay internally before doing the sedation. Anyway, so blood work or other diagnostics before sedation, maybe. And then to go home, that sort of depends, right? So there may be nothing to go home with, no medications. There might be antibiotics, depending on how bad the quilling was, and did the vet have a hard time removing some of them? Did some already look infected or kind of questionable? So antibiotics, maybe, up to your vet. And then I imagine probably most don't need them, but I imagine the ones that have to wait a couple of days to see a veterinarian in person may need them. But again, up to your veterinarian. And then pain medication, either opioids or narcotics like tramadol, or nerve medication like gabapentin, or non-steroidal anti-inflammatories, of which there's a bunch. Whatever your vet thinks is appropriate, or a combination. Probably a couple of days worth of analgesia for your dog until they're feeling pretty good. I imagine That also depends on your veterinarian's opinion on that, what they want to do, and also your pet, how they act with pain. Some animals you can't tell, they're acting fine after a dequilling. Others need it for at least a day or longer. So that's the details. So it's an outpatient procedure. They'll go home that day, probably, as long as there's no other complications. And now, whether or not your veterinarian wants to add an Elizabethan collar, an e-collar for your pet, is up to them. You don't want your pet scratching at any of the wounds or the puncture points where the quills penetrated the skin. So if they're messing with their face, you're going to want to have a cone on them, and possibly you'll need not anti-inflammatories, either antihistamines like Benadryl or something to help with the irritation, or sedation at home like trazodone or acepromazine, gabapentin, tramadol, to help with calming the nerves a bit so they don't mess up with their face and cause more issues. And then, of course, prevention is obviously you want to prevent them from interacting with porcupines, or at least teach them to run away from a porcupine. They see them. But, we've had plenty of dogs on vet triage that are repeat offenders when it comes to porcupine quillings. And, it's just the nature of the beast, so to speak. That's it for today, folks. Thanks so much for those who are watching the playback. Subscribe, donate, all the good stuff, and we'll see you in the next one. Take care. Bye.